We were in the state semifinals, and it was our second game of the night. The girls had just scored, so everyone was cheering. Jasmine was serving next, and she moved into position to get ready. It just happened so quickly. One minute she's holding the ball, and the next she's on the floor. At first I didn't know what was going on. It took me a few seconds to figure out what was happening. She was breathing hard during the game, but Jasmine always pushes herself. And she's just gonna keep playing.
Although rare, sudden cardiac arrest, or SCA, is the leading cause of death among young athletes, and according to the U.S. Centers for Disease Control and Prevention, 2,000 people under age 25 die of SCA every year. SCA occurs more frequently during athletic activity, and males are 4 times more likely than females to suffer from cardiac arrest. SCA occurs when the heart suddenly and unexpectedly stops beating. It's caused by immediate loss of heart electrical function, usually from an irregular and rapid quivering of the ventricles called ventricular fibrillation. These irregular heart rhythms rarely resolve on their own. Untreated, ventricular fibrillation can cause the heart to completely stop beating in 3 to 5 minutes. Rapid emergency response with cardiopulmonary resuscitation, or CPR, and an automated external defibrillator, or AED, can sometimes re-establish the normal heart rhythm, preventing sudden cardiac death. This course will help explain the causes of these rare but tragic events and what school and community members can do to prevent them. It will also discuss best practices in responding to sudden cardiac arrests among student athletes. We will discuss common causes in those younger than 30, risk factors and warning signs, prevention, and emergency response planning. At the end of the course, you'll have a chance to test what you've learned with a short quiz. So, if you're ready, let's get started.
Good afternoon, teachers and staff. Just a reminder for those who
For athletes over 35 years old, 80% of SCAs are associated with atherosclerotic coronary artery disease, which can block blood flow to the heart. However, for athletes under 35, SCA usually arises from an electrical disturbance in the heart that disrupts pumping. SCA is 60% more likely to occur during exercise or sports than in other activities for young people, but it's also important to remember that non-athletic students may experience SCA as well. It's sometimes difficult to determine most causes for SCA in student athletes before they collapse and, in some cases, die. Some of these causes include a thickening of the heart muscle, heart structure abnormality, electrical defect that interrupts the normal rhythm of the heart, other causes such as illicit drug use, inappropriate prescription drug use, and excessive energy drink use, and a sudden intense blunt blow to the chest called commotio cordis.
I was sitting with the other parents, and I looked over and I saw Jasmine just collapse on the court. At first, we thought she just passed out, but then the coach ran out on the court and started assessing her vitals. She had no pulse, no breathing, no color.
I think we just started yelling for help.
Yeah, yelling, "Call 911." It didn't look like there was any life in her. At that point, I didn't know what to do. You just have this overwhelming feeling of helplessness.
But then people started moving so fast, they just started running to help her.
A young athlete is at higher risk for SCA than others if he or she currently has or previously had a previous SCA or other heart failure event, episodes of fainting from unknown causes, thickened heart muscle, heart rhythm disorder and/or heart murmur, heart valve disorder, blood vessel abnormalities, and/or prior medical workup for the heart. Family history also plays a large part in determining risk for SCA in a young person. Students with a family history of premature death or disability from heart disease in a close relative before age 50 or certain heart conditions such as hypertrophic cardiomyopathy, Marfan syndrome, and others are at greater risk than those without a family history of heart issues. Let's look at some possible warning signs of cardiac issues in the young. Later, we'll discuss how to institute practices that can help detect these issues. Some possible warning signs include dizziness, unexplained shortness of breath, racing or fluttering heartbeat, unexplained seizures and/or severe headache, fainting and/or lightheadedness, fatigue, chest, arms, jaw, ear, and/or neck pain or pressure, and indigestion, heartburn, nausea, and vomiting. Keep in mind that not all young people exhibit warning signs of cardiac issues. Studies show that victims of SCA who experience warning signs or symptoms, like dizziness or shortness of breath, don't always tell someone because they don't realize the issues could be serious and want to keep playing. Any school program should clearly communicate to students that safety and wellness take priority over any sport activity. Make sure students know that they should notify an adult if they experience any possible warning events without fear of punishment. When a student does share a concern, appropriate school staff must protect him or her from inappropriate athletic activity until cleared by a medical doctor. To help prevent SCA, students should submit to a medically supervised screening every year before participating in athletic practice and events. The American Heart Association provides a helpful 14-part evaluation that asks questions about family and personal history, as well as heart-related symptoms such as fainting or chest pain. The screening process helps flag individuals who should be referred to a cardiologist for further evaluation. These students will receive cardiac medical care and may even be able to return to athletic activity using an internal or external cardioverter defibrillator, a device that tracks heart rate. Medical doctors, athletic trainers, school nurses, and coaches must work together to ensure all students at risk of SCA receive an appropriate medical clearance before participating in any athletic practice or event. Personnel must follow clear screening, referral, and return to activity policies based on state law and national best practices. Danielle, a school nurse at Westmont High, reviews completed pre-athletic participation history and physical forms in her office. She notices that the physician tagged one from a sophomore football player named Jay. The form shows that he's had some recent fainting episodes and his physical revealed a heart murmur. The first game isn't until next month, but practice starts tomorrow. What should Danielle do?
She fell over there. As part of our training, our school would have frequent drills throughout the year, unannounced, like what to do in an emergency, like calling 911, starting CPR, and how to work the AED. Because of these drills, there were some things that were just instinctual to me that day. The AED is right outside those doors. Jasmine was in VFib, so the only way to get her heart back on track was to give it a shock. It helped bring her back to life.
If a sudden cardiac arrest isn't treated within minutes to establish a normal heart rhythm, a person will die because the heart can't pump blood effectively to the brain and body. The best chance of survival from a sudden cardiac arrest is prompt recognition and a planned emergency response with CPR and AED use, following steps outlined in the chain of survival. The chain of survival comprises a sequence of 5 events that must occur quickly to optimize a person's chance of surviving a cardiac arrest. They include 1. Immediate recognition of cardiac arrest and activation of the emergency response system, like calling 911. 2. Early CPR with emphasis on chest compressions. 3. Rapid defibrillation. Using an AED can establish a normal heart rhythm, especially if used in the first few minutes of a cardiac arrest. 4. Effective advanced life support. And 5. Integrated post-cardiac arrest care. CPR manually pumps blood and helps deliver oxygen to the brain and body until regular cardiac rhythm is restored. AEDs assess a person's cardiac rhythm. If warranted, the AED can provide an electrical current to the heart, which can transform the irregular, ineffective, quivering heart rate back to a normal rhythm. National best practices require each school, institution, or organization to have a written emergency action plan to respond to SCA events. Schools must also supply a copy to staff and volunteers involved with student athletics and provide regular training for each emergency role. The plan should involve the Community Emergency Medical Services, or EMS system. It's crucial that all staff and volunteers have adequate training to provide emergency care, so schools should hire athletic trainers and credentialed school nurses to coordinate pre-participation screenings and training events. They should also provide regular access to quality CPR with AED classes. Prior to each practice or competition, all athletic healthcare responders must take a timeout, a short meeting where they should review the emergency action plan, establish the role and location of each person present, decide how communication will occur, for example, voice commands, radio, hand signals, and discuss a backup method. Determine the location of and procedures for the standby ambulance present at all high-risk events or the best way to call for one. Agree on a designated hospital that can best treat SCA. Assess any emergency equipment present. Where is it located? Is it in good working condition? And discuss any special circumstances that could affect the emergency action plan. For example, weather, crowd size, or construction. In case of an SCA emergency, a member of the athletic staff should accompany the student to the hospital. Other personnel should contact the parents or guardians immediately if they're not present and keep the crowd at bay from the ensuing event.
You really can't describe the fear or the thoughts that run through your mind when something like this happens.
It really just looked like they were running a drill. The coaches and assistants, they were there so quickly to help her. It was amazing.
We still can't believe this happened. We're just so lucky to have Jasmine with us today.
And that is because everyone was so prepared. After this, we won't let our children play any sports where there isn't an AED machine nearby. We're so glad that our school already had one and the right people knew how to use it. Waiting until someone's gone, it's too late.